For much of the last year now, too many of these have sat empty. Operating theatres in hundreds of hospitals underused because of coronavirus. Without staff or beds in critical care, many urgent operations have been cancelled. But the need is still there and still urgent.
After 2 cancellations now, I'm really starting to worry about it.
Glyn Lewis has prostate cancer. He's been waiting for surgery, but it keeps being postponed, and now he doesn't even have a future date.
They will just monitor it and look for and wait for changes, basically. So, you know, the way I see it, it's gambling with my life, isn't it? Like, you're waiting for it to get worse before they treat you.
So concerned, Glyn is now raising money to have his operation done privately. NHS England insists surgery that should be done within 4 weeks will be prioritised. But some hospital trusts have had to cancel such procedures. One cancer hub at the Royal Marsden in London is taking patients from across the southeast to ensure they are treated.
It is unheard of, but it's worked extremely well. And actually over 5,000 patients now have been operated on through our hub. And since early January, 357 patients have gone through the hub in the second phase.
Clean cancer hubs like this are saving lives. There are a few others across the country where hospital trusts have joined forces, but given the scale of the problem and the horrible reality that survival rates are reduced by 10% for every 4-week delay, I think it's quite clear that there simply aren't enough of them. In the first 2 weeks of January, there were 800 fewer cancer surgeries than usual, leading some now to describe it a crisis.
We have to save cancer patients as well as COVID patients, and I think the question for the government is, are they prepared to invest and make the same urgency and priority to this as they have done with COVID and the vaccines?
Peter can't even get a diagnosis. He's lost 4 stone in 6 months. Despite concerns he has cancer, numerous scans have been postponed.
It's not a life. This ain't a life. This is just laying there and wondering what's happening the following day, and nothing's happening the following day. And then when people phone up and say there's nothing we can do, there is something they can do. They can do a part of that hospital to get the people in. But why should other people suffer for a virus?
We may never know the true extent of the damage done to cancer patients. The tragic legacy of COVID looks set to continue for years to come. Emily Morgan, ITV News.